Hi, I'm Orland Park Mayor Dan McLaughlin. There's been much discussion regarding the use of heroin and other drugs lately. We want everyone to know that the Village of Orland Park and its police department remain on the front lines of this battle. The police department has put together the following program, and we invite everyone to learn more about how we can all work together to combat this problem.
Hello and welcome to Orland Park InFocus. Today's program will mark the beginning of a new and exciting effort to continue to communicate and inform the Orland Park public with relevant and timely information that will be important to all of us. My name is Jerry Hughes. I'm the Deputy Chief of Police for the Village of Orland Park. Today, in our very first presentation, we seek to continue the ongoing dialogue in the village regarding concerns of drug use, but particularly use of heroin by young people in our community. We've invited some experts and hope you will join us for a series of 3 segments that will cover various topics related to this heroin issue. Each of these segments will be available on the Orland Park Municipal Television Station and on the Village of Orland Park website as well. Additionally, some informative and useful information will also be available as resources on the Village of Orland Park website, and we encourage you to look for that as well. We hope you will join us for all 3 segments. Now, as we begin our first segment, we look for some answers regarding what is actually happening in our community. There's been a great deal of information flowing regarding heroin in our community, and there's some data available to us that shows us there just is cause for concern. Nationally, though overall heroin may be somewhat stable, according to the U.S. Department of Justice, use is increasing among young people in many suburban and rural areas. Illinois has seen an increase in young suburban users among 20 to 24 years of age. From 1998 to 2007, hospital discharges for heroin use among Chicagoans declined some 67%, but increased more than 200% in the collar counties. The panel of experts with us today should help us to understand where our community is with this problem. We begin our discussion with an introduction of our panel. Timothy McCarthy is the Chief of Police in the Village of Orland Park and has served in this capacity for the last 18 years. Chief McCarthy is also the Chairman of the South Suburban Major Crimes Task Force and is a member of the board for the Chicago HIDTA. Prior to coming to Orland Park, Chief McCarthy served in the U.S. Secret Service for 22 years, where he served on the Presidential Protection Detail and was agent in charge of the Chicago office for 5 years. Chief, thanks for being here today.
Thanks, Jerry.
Ken Brookie is the Fire Chief of the Orland Fire Protection District. Chief Brookie was officially sworn in as Chief in early of June this year. Prior to coming to the Orland Fire Protection District, he served the Pleasant View Fire Protection District for 18 years. Chief Brookie has considerable experience in the EMS field and has served as a trainer in many critical aspects of the fire service. Chief, thanks for being here today.
Jerry, thank you for the invitation.
Dr. Mark Netzel is Chairman of the Emergency Department at Panelist Hospital in Palos Heights, Illinois. Dr. Netzel has practiced emergency medicine for 26 years, is a board-certified emergency and urgent care medicine. Doctor, thank you for being here.
Thank you for the invite.
Dr. Silvio Morales is the Medical Director of Emergency Medicine at Silver Cross Hospital in New Lenox, Illinois. Dr. Morales is a board-certified physician and has been practicing emergency medicine for 15 years. Panel, welcome all, and thanks for being here. This is certainly a well-rounded body of experience to tell what's actually going on in the field. I don't know if it's not you for who else knows what's actually happening with heroin and drug use in our community. So I'd like to open our discussion somewhere in that area, because so much has been said and so much has been in the media about the problem of heroin and the perception of an increasing trend towards increased heroin use in our community. I'd kind of like to ask the 4 of you to reflect in your various aspects or your various organizations and tell us a little bit about what you've been experiencing in the last several months to a couple of years, and if you've seen an increase in what you've been seeing, what's been going on. And Chief McCarthy, could we start with you?
Thanks, Jerry. Certainly alcohol and marijuana remain probably the most abuse drugs. But in the last several years, we have seen a huge increase in the amount of heroin that's being used in our community. The difference between heroin, alcohol, marijuana, and some of our other drugs is the deadliness of heroin, the addiction rate of heroin, the recovery problem with heroin, and all of the social problems that come with it. We've also seen that Mexican heroin production has increased eightfold in about the last 7 or 8 years. Heroin is available, it's cheap, it's potent, and it is extremely addictive. And the doctors will talk about what it takes to cure the habit of a heroin addict. We are seeing an increase in overdoses in Orland Park. Chief Brucky will be able to talk about that, what we're trying to do there. And we're seeing an increase in deaths in Orland Park as a result of heroin. Again, it's a deadly substance, far more deadly than most of the substances we've seen in the past. We see more polydrug use that leads to addiction. And what we're also seeing is a huge abuse in prescription drugs. Our young kids are using these prescription drugs, and they're part of the chain of addiction. When we interview addicts, when we interview people we arrest for heroin, we try to find out how it started. And it typically starts with a cigarette in the garage, to alcohol, to marijuana, prescription drugs, cocaine, polydrug use, which is the use of different drugs simultaneously almost, and now on to heroin because it's available, it's cheap, and it's potent. And we also find that many of our youngsters, and we're not seeing much, by the way, until they're over 18 years old. We're seeing very little before then, but I don't think in many cases they know exactly what they were using. In some cases they think since they're snorting it, they think it's cocaine, and it is not cocaine. It's far, far worse. The addiction rate is far worse, and the recovery rate from the addiction is far worse. So we have a problem. As you pointed out, it seems to be, at least in Orland Park, a little bit older, 20 years and above, but there's this chain of addiction that starts, as I said, with cigarettes alone, and we need to break this chain of addiction somewhere along the way, and we have to start now, and that's why I'm so pleased that we get people like the two doctors to be here with us especially, and of course Chief Brucky to talk about this subject.
Very good, Chief. Chief Brucky, how about the EMS? What's the EMS people saying?
Yep. You know what? I'd like to, just piggybacking off of what Chief McCarthy had to say. Yeah, I mean, we are in the pre-hospital setting for our treatment outside of going through an initial medical care and trying to figure out what the problem is. Drug abuse is the pre-hospital setting doesn't change a whole lot. Our treatment remains the same. There's an initial protocol for that. But then we started seeing that as part of our pre-hospital treatment, the more of these folks were responding to medication that we would give them that would lead us in the direction of an opiate. So then we started narrowing it down to more heroin as the likely cause. Prior to that, we didn't really have a collection system in place to collect the data to be able to monitor it. We realized that it was a regional problem, so we partnered with a few MABUS fire divisions to the tune of about 45 to 50 fire departments to start collecting some of the data. We started that in 2009, and we realized that each and every year we could contribute some of these treatments to simply heroin, either use or abuse. And in collecting that data each year, we've seen an increase of numbers just in our community. We don't have the percentage really dialed in, but as of 2012, we started in 2009. As of 2012, we've treated 27 cases that are attributed, again, not necessarily in the younger community, as Chief McCarthy had stated earlier. We put our measurement out to age 30. So anywhere between any case that we were seeing up to age 30. And already we've seen 27 cases this year through May, through the end of May. And that would be an increase of about 50% compared to what we've been seeing over the last 3 years.
It's interesting. Dr. Netzel, how about the Panelist Hospital Emergency Room?
Yes. First, I wanted to commend the Village of Orland Park for actually having an educational seminar like this, because I think this is
This is something that is very, very important for the community, and I don't think that the problem of drug abuse is really recognized by the people that live in the community. I just read a study that when parents were surveyed, about 10% of parents thought that drug addiction and drug use was a problem for their teen. But when they surveyed the teenagers thought it was about 25 to 30% of them thought that drugs was a problem within their circle, social circle. So I think that it's underappreciated, and I think educational programs like this and getting the word out to the community is very, very important. And as we'll talk about later, education, not only the user of the drug, but also the parents that are involved and the families that are involved. So
Absolutely, sure.
I commend the Village of Orland Park for having this get-together. But as far as heroin use, it certainly has had a surge since probably the late 90s, early 2000, as far as the drug use. In the old days, we used to think heroin was an injectable drug used in the inner city by the older population, and surprisingly, over the last several years, it's being used now by the teenagers, and as you mentioned earlier, in the early 20s. And I think part of the problem is they feel that since it's not being injected, they actually snort it or they smoke it. And they erroneously feel, the user feels that it's not as potent or not as destructive if they snort it or smoke it, which is a big mistake. As we'll talk about later, it's as addictive as it would be injectable. And it's the manufacturers have made the product more potent and more pure because they're snorting it and smoking it, and therefore the deleterious effects are more serious. So I think that definitely needs to be recognized. And unfortunately, it's a cheap product. Buying a bag of heroin nowadays can be just a few dollars. And I think in our environment, the teenagers have access to funds and money, and unfortunately, the ability to buy the drug is there. So unfortunately, the soil is fertile for this, and I think the parents need to be educated and be on the lookout for this type of use. And I think the teenagers need to be also educated as far as how to handle situations where they may be confronted with friends or colleagues that use drugs. What can they do to help their colleague?
Thank you, Doctor. Dr. Morales, how about Silver Cross?
Well, first I'd like to echo Mark and thank you for having me today. And efforts like this to increase community awareness are of vital importance to try and get ahead of issues like this. I think Silver Cross situation is probably similar to what it is at Panelist and other community hospitals, where unfortunately we are seeing an increase in the number of heroin or narcotic opiate-related visits to the emergency department, whether those be for acute intoxication of the drug and effects of acute intoxication, or the struggle of patients through withdrawal, trying to overcome their addiction. So we're really seeing the range. We're seeing an increased number of patients acutely under the influence of the drug and all those life-threatening consequences, and then also really the life-threatening and life-changing effects of trying to go through withdrawal and trying to get clean and stay off these drugs. So we're seeing the entire spectrum of the problem.
As far as what we're seeing in the emergency department, I think we're seeing kind of the whole gamut. We will see the patients that are brought in by the EMS that have acute overdoses, that will be obtunded, on the verge of going into a coma. They'll have decreased blood pressure, decreased respirations, because heroin is a depressant, it's a central nervous system depressant. So essentially, if they take enough of it, they'll stop breathing. So we will see the patient that comes in the acute situation where they need life support. They need to be intubated, they need to be put on a breathing machine and support the vital signs until the drug is metabolized. We also have some antidotes for heroin specifically and narcotics that we would use to help the patient recover from the acute episode. But then on the other end of the spectrum, in our emergency department, and I think Silvio also has the same experiences, people are coming in because they recognize that they're using the drug, and it is addicting. It is a financial hardship, it's an emotional hardship, and basically it's destroying their family. So they'll come in for treatment, so they won't be under the acute situation, but they're coming to us for help, and then we will introduce them to our treatment program and try to get them into a program that can help them through their difficult time and through their addiction.
I see. It seems like everyone is pretty much experienced in their fields there definitely is some trends and then going in the wrong direction. I think we could all agree to that.
Yes.
Some of it may be somewhat anecdotal in nature as far as terms of data is concerned. But I know we've talked before a little bit. I know the fire district, Chief Brookie's staff and our staffs have talked a little bit about the challenges of good hard data, that it can be difficult. This particular topic doesn't measure easily because what the police department get called to is not always the same as what shows up in the emergency room, or the ambulance may go to a call where the symptoms may present themselves in one matter, later find out in the ER to be a heroin overdose.
Well, we find, Jerry, that many parents, people who overdose are brought into the hospital by friends, family members, and certainly it's not something they want reported to the police if they don't have to. On the other hand, we do track all of our heroin arrests and all of our the overdoses, and working closely with the fire district now, we're trying to go back to find out where they're getting the heroin from, and we have been able to work with HIDA, DEA, Chicago Police, and Illinois State Police only recently to go to some of those locations and make numerous arrests to try to stop the flow of the heroin into our community. But as you point out, finding out the real depth of the problem and the amount of overdoses is pretty difficult.
And that's important. That's an important determination too, to highlight that, because we're all seeing various aspects of this problem as a whole. The issue with collecting, as Dr. Netzel had laid out, the issue with collecting the data is we're seeing it in the acute setting. These folks are in trouble. By the time we're treating them, we're not seeing the casual user. We're seeing the abuser. I mean, these are people that are in real trouble and have a medical condition. So the data that we're collecting is the acute user. It's not necessarily reflective of the numbers as a whole.
Mm-hmm.
And that's an important determination.
I think that's an important point. EMS typically would only get called when somebody has abused to the level that they're in a life-threatening condition, because as Chief said, that same as families often don't want these things reported. Well, their peer group also don't want these things reported to the authorities either. And then if we see patients who are coming in for withdrawal symptoms, typically those patients won't come in by ambulance. They'll come in by private vehicle. So it's very difficult to ascertain the full scope of what's going on.
In preparation for some of our other segments, which people will be able to see at another time, I can't help but kind of reflect on what we've learned in talking to those folks, that delay in treatment or delay in seeking medical help or delay in seeking treatment for addiction, especially with heroin, is devastating. And I think that's what you're talking about, is you're treating acute patients. By the time they're showing up, they're more of acute. They're not in the early stages of heroin addiction. Would you say that's right, Dr. Morales?
I think it is because
I'm sorry, Dr. Netzel.
I think that, again, often they'll start with snorting or smoking the drug, heroin specifically, and then 3 out of 4 of these users will go into the IV or injectable form. So obviously, the sooner you can get to the crux of the problem, the better, so that it would not lead to intravenous use. Plus, it would cut down on the side effects that the drug causes, because there's not only the short-term side effects of respiratory depression, coma, losing your protective mechanisms for breathing, but also the long-term effects of things like, if you're using the syringes, passing on infections, HIV, hepatitis, and collapsing of your veins, endocarditis, in the addiction itself. So there are many long-term problems that can happen with the user, and obviously the sooner they get treatment, the better the prognosis.
We've been talking a lot about heroin, and there's been a lot said about heroin. What are some of the other drugs that are mostly concerning to us right now? We've talked a little bit about polydrug use. Chief McCarthy, can you reflect a little bit on us? What are officers seeing, and what's concerning in law enforcement? Is heroin the top concern now? What else is going on in terms of drug use in adolescents?
Well, heroin has become our top concern because, as the doctors pointed out, how deadly it is. It is so deadly. But we see many other things as part of this chain of heroin addiction. It starts out with education and employment, that they lose their jobs when they become addicted to heroin. Many heroin addicts, particularly women, become victims of crime, sexual assaults in particular, when they're living their life among other heroin users. There is crime that takes place as a result to feed their habit. They've lost their job, oftentimes their employment, they're losing their source of income, they're losing their homes, they're losing their families, and they become victims of crime. And finally, the efforts to beat the habit, to try to rehabilitate, often fail. And we see, see many cases where one time after another they go for rehabilitation and it simply doesn't work. So this heroin really attacks the entire social fabric, not of the family, of course, because families break up over this type of thing all the time. It attacks the fabric of the community because it increases crime to feed the habit, and many of them become victims of crime themselves, and particularly women, and I can't stress that enough, that they often become the victims of sexual abuse as a result of their heroin addiction. So it's this one, heroin seems to have so many more consequences than most of all the other drugs, and certainly, as the doctors pointed out, which I think can't be stressed enough, how addictive it is because it's so potent, and as Dr. Netzel said, by design.
Dr. Morales, what do you think about the drugs we're talking about? We talk a lot about heroin. In your perspective, are there any other things we should be more concerned about? Is heroin it right now?
Well, unfortunately, I wish we could say heroin's it right now, and we could focus just on that and not have to worry about other things. I think, as Chief said at the outset, I mean, you never forget about alcohol and marijuana. Certainly, those remain at the top of the list or close to the top of the list, and begin a pattern of future substance abuse that can be life-changing and affect people's lives. There's other things that we worry about. Certainly there's, many may have seen things on the internet or in the news now about synthetic substances, often called bath salts or advertised as bath salts, that are advertised as benign, and kids think that they're not serious, but these have devastating effects. They have almost PCP-like effects on the user at the time that they're under the influence, and then afterwards have been shown to have significant paranoia, hallucinations afterwards as kids are coming down from these, psychotic events, a lot of depression, and there's even been some suicides attributed to patients, the effects after using those drugs, not under the acute intoxication portion, but the after effects of those drugs. And so I think there's a lot of kids that, because they can get it over the internet or they're labeled in pretty jars, think that this is a benign thing, but this is a substance that can be devastating.
You know, some of the literature in the prevention field has indicated that we haven't been clear enough in some cases at talking about how dangerous heroin is with young people. So I think it might be important for us to reflect for a minute on what does it look like, what does treatment look like for an acute heroin addict who seeks treatment out. Chief Brookie, can you tell us what a call looks like when an ambulance shows up?
Yeah, certainly. We've been talking a lot about what the acute use is, but there are several signs and symptoms that lead up to that acute use, or just general use or use in general. I'd like to highlight some of those because it'll walk you through use to abuse in the acute setting, because there are both physical and behavioral signs. If you begin to notice a sudden change in behavior, obviously that would be the initial onset. There might be mood swings, irritability, they're grumpy, suddenly happy, or bright. It can go either way, depending on the level of use and just the makeup of the individual using it. There might be some withdrawal stuff from family members, from friends, careless about personal grooming. There might be change in sleeping patterns. That's a big one, where they'll be up all night, sleeping during the day. Whereas that doesn't sound unlike the typical teenager. That makes it even worse. You need to be able to focus on that to see if there is any other thing in addition to that change in sleep pattern. Red or glassy eyes typically are it, and sniffy or runny noses. So there are some symptoms that lead up to, or that would indicate use before we hit abuse. But in this setting, by the time that the emergency medical services are contacted and go to a typical house, that individual is already in trouble. They're compromising, something has been compromised in their system. So we'll go through an initial medical routine. We'll begin to isolate what the substance might be. And many times we can't, isolate it to a particular product. But during the course of that treatment, that's what kind of clued us in early on, a couple of years ago, after about 2009, when we started treating them, and we would issue a medication, Narcan, for an opiate use. We started seeing the physical effect of that, meaning we were able to impact treatment with the use of Narcan, and it dialed us into an opiate use or abuse. So we started to see that in taking them and delivering them to the hospital, and then maybe the doctors can pick up with the treatment up to that point.
The challenge, as he was alluded to, is you don't know sometimes or often what the substance is, or if there's more than one, maybe polydrug abuse. So when the patient comes in and it's a known overdose, there's a protocol that we follow. Patients are put on cardiac monitors. They're given supplemental oxygen. IV fluids are started on the patient because they often have a low blood pressure. And we do use antidotes, and for our narcotics, specifically Narcan is one of the medications we use, and sometimes start a drip that blocks the receptors in the patient's body for narcotics. And it can be life-saving as far as its use. And then, as I mentioned earlier, basically supporting their vital functions, supporting their blood pressure with fluids and sometimes vasoactive medications, supporting their respirations. Because as a respiratory depressant, the drug heroin will stop you from breathing. It'll cause secretions to gather, and you can aspirate, causing pneumonia, and stop breathing. So often these patients need to be put on a ventilator and life support for a time being to support these vital functions. Sometimes the permeability of fluids in the lungs is altered, so the patients undergo what they call pulmonary edema. Fluid accumulates on the lungs, and they literally cannot breathe because of the fluid on their lungs. So in that setting, patients are on a ventilator. They're put in the intensive care unit for several days to get them through.
Doctor, would it appear, and it seems to me, that the mortality rate for long-term use of heroin far exceeds any other drug so far?
I would say long-term, yes, absolutely.
Yes.
I would agree with that as well.
Because one of the reasons is with years and years of using the drug, again, additives are in the substance with each use, and you don't know what the additives are. And it can cause problems with your immune system and break down your immune system and set you up for terrible opportunistic infections and inflammation around the heart, strokes, and basically cause a problem with your immune system to fighting infection.
And I think it's important to note too, especially with the young user, they just don't understand how devastating the effects are of this drug. And our window of treatment gets smaller and smaller based on the abuse. So meaning our window of treatment is much less to overdose. And I don't think that these folks understand just how devastating the drug is based on their use.
Right. I just would reiterate also that just because it's being snorted or smoked, it does not make it less deadly than if it was IV use. It is as deadly and it is as addictive as the IV form.
And I think a couple of points that have been made just to put them together. As Chief said, by design, and Mark had mentioned, by design, these drugs are being made more and more potent and more addictive. And we're seeing a shorter window of time before these kids have very serious, life-threatening overdoses. And I don't know about you, Mark, but we're seeing times where, let's say, several years ago, 1 or 2 doses of Narcan, and somebody would be okay. Narcan being one of the antidotes, or the primary antidote that we can use for narcotic overdose. Where now more and more we're having to put patients on Narcan drips because the potency has gone up. And what used to be an antidote that would save somebody's life now has to be given in increasing doses or in a continuous intravenous drip because the potency of what these kids are using is completely different than what it was several years ago.
Heroin has definitely changed things, no doubt about it. But in talking about the long-term effects, or at least the social aspect, I think should also be considered. The medical aspect for a user, or certainly an acute user, as you described, is one thing, but I think Chief MacArthur, you could probably reflect for us on, and I think you did touch on it already a little bit, but what's the life of a person who's an acute abuser of a drug like heroin, the family, the jobs, the life of crime? What do we know about people like that and their future?
Well, we have the cases here in Orland Park. I mean, this is a regional problem, and it's a local problem. And it starts out with, as we said, a health issue. Look what it does to our hospitals alone, the work they have to go through, the mortality rate, the crime rate goes up. We know the burglaries that take place, they don't seem to, the heroin addicts don't seem to be violent, commit many violent crimes. The frauds, the family situation where heroin addicts will steal everything out of their household to feed their habit. They become victims of crime as well. So the cost to police agencies in dollars and cents goes up as well. And it's just, this heroin issue just seems to have so many consequences in the health field, in the EMS field, in law enforcement, and it certainly destroys a family. We've seen so many families in Orland Park that simply don't know what to do with their loved ones anymore who have been addicted to heroin. They don't know what to do. They have to lock up everything because if it's not locked up, the VCR will be gone, the television will be gone, the toaster will be gone. It will all be gone. So the consequences are just far more than I've personally seen with any other drug. And the doctors pointed out how potent this is. Potent by design to hook these people on it for life. And I've never seen any other drug quite as bad. Crack, of course, it can be very, very potent also, but we're not seeing that much crack in and around Orland Park, and I think largely in the suburbs. But it just has so many consequences to all of our professions, but to the quality of our life wherever you live, in the city, in the suburbs, and anywhere else.
I don't think we want to send a message that recovery or turning one's life around from an addiction is a hopeless cause, but I think the odds of being a contributing member to society, holding a job, maintaining a family life, those are those not characteristics of addiction problems, that they tend to be challenges in people's lives to carry on a normal and healthy and happy life. I think you could all speak from your perspectives about seeing those kinds of problems, how it really tears the social fiber of a family and of a person's future. So, but I think the end message is do not delay treatment. Do not take any time in getting help, and it's important to seek out help when you can. I think you've all made that clear, because once you are a chronic user, as you pointed out, it's a pretty tough situation. I think we'd all agree with that.
Very much.
The other message I was going to suggest is we've been talking about the devastating effects of heroin and drugs, and there's, I feel, a need for educating parents and teenagers the importance of actually having a dialogue as far as the prevention of all of this. Talk to your kids, talk to your teenagers about, is there a drug problem in their circle, at school? Just keep the lines of communication open, because I think that I have to believe that prevention is the #1 cure for this. And if you could start a dialogue with your teenager, let them feel comfortable talking to you about drugs. They don't have to rat anybody out, they don't have to talk about specifics, but just open the dialogue so that it's something to talk about, so that if there is a problem or there is an issue, they know who to go to. They can go to an authoritative figure and you can help them through the problem. So just the point being that I think prevention is the key here, and hopefully it could prevent all this type of situation from happening in the first place, opening up that lines of communication with your teenager.
Well, I hope, Doctor, that a program like this helps. Doctors are viewed to be very authoritative figures in our society, and your perspective on this, I think, is going to be very helpful. Everyone hears from the police all the time, and ours is kind of a negative reaction to it. But we do our DARE programs, and in Orland Park, we've taken it, the DARE program, to the next level. We know it's not a silver bullet. We've never claimed it was. But we've taken it to the 8th grade now as well, where we give a very blunt, what you've heard here today, they hear now in the 8th grade from us, and then we're one of the few communities that have been able to do that. But doctors are held in pretty high esteem, and I think coming from you is going to be a very powerful message, what you've relayed to us today.
And summits like this are just paramount in getting the message out of awareness. Nothing from a punitive. I mean, this is a public safety need, and we all certainly have a piece of that. And in the end, we need to. That's the message. It's a public safety need, and we're here to address public safety needs. And raising the awareness, I think, starts the ball rolling to prevention.
Well, as our time winds down, we're just about out of it, but I did want to take a moment to express our appreciation for you taking the time to join us It's been a great panel. Your expertise collectively, I think, will give people a lot of information that they thought was certainly needed. And as Chief McCarthy pointed out, it's certainly coming from the doctors is certainly a next level up, and we really appreciate your time. But Dr. Netzel has touched on a good transition for me to remind everybody that the second segment of our three-part series will be with a panel of experts in the prevention, counseling, and addiction field, and they'll be here to talk a lot more about prevention and how families can cope and what they should do and next steps. Thank you for watching. I hope you'll catch all three segments of this very informative program. This is Orland Park in Focus. My name is Jerry Hughes. Thank you for being with us.